Hey everyone, welcome back to all my listeners. This is episode 2 in season 15. Today is Wednesday, May 14th, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, so can you believe it's already the middle of May? I can't believe this month is also flying by so very quickly. But last time we spoke, I was waiting for spring, and guess what? It has popped up here in Chicagoland. It is just gorgeous. I know so much of the nation already had their spring flowers and blossoms on trees, but I am finally enjoying peak spring blossoms right now. So I'm so happy. I am just soaking it all in. It's not my favorite season, but it's right up there with fall. So I'm really enjoying the burst of color, all the fragrant smells of the flowers. I'm very, very happy. All right, you guys. So let's go ahead and get into today's episode. Now, it is the second Wednesday of the month. And for those of you in the audience, my loyal listeners, I focus on the Office of the Inspector General, the OIG, and their work plan updates for the month. And so in today's episode, I'm going to be featuring the month of April 2025. And in my trusty tip, I want to focus on documenting time. And of course, I'm going to go ahead and close out and round out today's episode with a remarkable quote on hopes and aspirations by Albert Einstein. All right, you guys, let's get into it. So in today's Newsworthy, I'm going to be focusing on the April OIG Work Plan updates. Now, for the month of April 2025, there were 4 updates that were made. Now, the first OIG Work Plan update for the month of April 2025 is titled 2024 Performance Data for Senior Medicare Patrol Projects. Now, this report is going to be expected from the Office of Evaluation and Inspections. The Administration for Community Living Senior Medicare Patrol, or SMP projects, were established to recruit and train retired professionals and other volunteers to prevent, recognize, and report healthcare fraud, errors, and abuse. Now, the initiative, which stemmed from recommendations in a congressional committee report accompanying the Omnibus Consolidated Appropriations Act of 1997, continues today. Now, the OIG will review the 2024 SMP project performance data and documentation relating to Medicare and Medicaid recoveries, savings, and cost avoidance. The Administration for Community Living requested this information, which will support its efforts to evaluate and improve the performance of the SMP projects. Now, this final report is expected in fiscal year 2025. Now, the second OIG Work Plan update made for the month of April 2025 is titled Data Brief, National Snapshot of Indian Health Service Sanitation Facilities Construction Projects Funded under the Infrastructure Investment and Jobs Act. Now, this report is expected from the Office of Audit Services. Under the Infrastructure Investment and Jobs Act, or the IIJA, Congress allocated a total of $3.5 billion over 5 years to the Indian Health Service Sanitation Facilities Construction Program, or the SFC program, to provide American Indian and Alaska Native peoples with essential water supply, sewage disposal, and solid waste disposal facilities. Now, the OIG will review data for the first 3 fiscal years, 2022 through 2024, to do number 1, provide a national snapshot of how IHS used and managed funds received under the IIJA for its SFC program, and number 2, highlight any challenges that the Indian Health Services faced to administer the SFC program projects and actions taken to address those challenges. Now, this final report is expected in fiscal year 2026. Now, the third OIG Work Plan update made for the month of April 2025 is titled Skilled Nursing Facilities Financial Responsibility for Medicare Part D Enrollees Drugs in Part A Stays. Now, this report is expected from the Office of Audit Services. Medicare Part A prospective payments to skilled nursing facilities, also called SNFs, cover most services, including drugs and biologicals, furnished by a SNF for use in the facility for the care and treatment of enrollees. Accordingly, Medicare Part D drug plans should not pay for prescription drugs related to post-hospital SNF care because payment for the drugs is already included in the prospective payment for a Part A SNF stay. Now, a prior OIG audit found that up to $465.1 million in Part D total cost was improperly paid for drugs for which payment was available under the Part A SNF benefit. That audit also found that some of the drugs administered to Part D enrollees during their Part A SNF stays had been provided to the SNFs by the enrollees or by their families, even though the SNFs were financially responsible for providing the drugs. Now, for this audit, the OIG will determine whether SNFs complied with federal requirements for assuming financial responsibility for drugs for Part D enrollees in Part A SNF stays. Now, for instances in which the drugs used during enrollees' Part A SNF stays were provided by the enrollees or their families and paid for by Part D, the OIG will determine why the SNFs obtained the drugs from the enrollees or their families. Now, this final report is expected in fiscal year 2026. Now, the fourth and final OIG work plan made for the month of April 2025 is titled Trends, Patterns, and Key Comparisons Related to Medicare Hospice Provider Enrollments May Indicate the Need for Further Oversight. Now, this report is expected from the Office of Audit Services. Federal requirements state that hospices must be certified by the CMS and be licensed as required by state and local laws. Medicare also requires that hospices meet its conditions of participation to receive payment. OIG's objective is to identify trends, patterns, and key comparisons that indicate potential vulnerabilities related to new Medicare hospice provider enrollments. The data brief might also help CMS evaluate the need for additional monitoring and program integrity efforts to ensure that hospices meet all the requirements. Now, this final report is expected in fiscal year 2026. Now, I just wanted to wrap up this segment with stating the many, many complexities of these programs, right? There were just these 4 updates, but all 4 of them are quite complex in how they are structured and how many hoops our providers have to go through, right? From this hospice participation, conditions of participation must be met for all of the drugs for the Part D or the Part A in the SNF stays, right? All of these payment models and mechanisms are rather complex. So our providers have a lot of legwork to do in the beginning as they're setting up their practices based on their patient populations and the places of setting that they will be seeing their patients. And now it's time for my best practice tips in Trusty Tip. Now, the whole month is dedicated to Mental Health Awareness Month, as I stated on the opening episode also for season 15. The month of May is focused on mental health awareness. Now, my Trusty Tips focus on best practice recommendations for behavioral health service lines specifically. Now, last week I went over the highlights and importance of treatment plans for this patient population. Today, I wanted to focus on time, because I still continue to see risks that practices and providers are taking when they are providing time-based services. For example, our psychotherapy sets of codes are time-based. There's our CPT code 90837 for 60 minutes. There's our CPT code 90834 for 45 minutes. And there's our CPT code 90832 for 30 minutes. Now, my best practice recommendations always include adding start and stop times. I think it's a wonderful idea for your EMR vendor to include start and stop time capabilities in your templates for your notes. Now, this addition, in my opinion, avoids the scrutiny from insurance carriers, the payers. The idea they may have that you are seeing many, many, many more patients than possible in a given day. Now, this concept of the impossible day is one that I've highlighted again and again on my month-end episode of Fraud, Waste, and Abuse Newsworthy Spots. Now, these codes also have minimum time thresholds that must be met to bill out on claims. So it's important to dig deeper into coding and billing best practices and guidelines. Make sure you understand the deeper nuances involved in these types of codes. And of course, looking at payer policy and their requirements is a must. At the very least, total time must be documented for ensuring accuracy of time spent with your patient. And finally, I focus Season 15 Spark on hopes and aspirations. I want this 15th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires us with their insights on hopes and aspirations. So, in this week's inspiring quote in Spark is from Albert Einstein. Wisdom is not a product of schooling, but of the lifelong attempt to acquire it. Wow, absolutely true, right? This is an incredible aspiration. This quote reminds us that wisdom can only be attained by continued learning. We are never done learning. Well after those diplomas and graduations, well into midlife even, we are still in pursuit of wisdom. I'm happy Albert Einstein's spark burns brightly and still inspires so very many. All right, you guys, that wraps up today's episode. Now, I hope you guys have a great weekend ahead of you. I hope you get to go outside, enjoy some nature, really, really find the time to decompress. Focus on your own goals, focus on your own aspirations and hopes, right? Definitely. This month of May is a good one to start practicing that before we roll into the summer season. All right, you guys, thank you so much for listening in on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.